Namaste, myself Dr. Soumya Villanavad. I'm a Chief Consultant at Diabetes Reverse at Clinic Private. I'm over here today to talk on the topic Cellulitis and Diabetes. So most of our patients are confused whether they started with the cellulitis and then they ended up with the diabetic ulcer, or it is a pure only diabetic ulcer which later converted as a gangway. So people get confused from cellulitis, diabetic gangrene, even though the words, medical terminologies, pathology completely different from a particular distance to other. How does diabetes is contributing to cellulitis? So let's see what is cellulitis. Cellulitis is something which is related to our skin disease, or they say it is caused by a bacterial infection of a skin. That could be an acute infection, or that could be a kind of a chronic urge. So any acute bacterial infection of the skin or skin structures, that is what causes a cellulitis. So most of the time, the patients doesn't understand how is the cellulitis started. They just might feel like, dryness of the skin initially, and they may start, most of the cellulitis patients, they won't see the opening of the skin. So it will be most of the cartoon kind. So they will not even realize when it all happened. Once by the time they realize it's already first formed or it's oozing. And most of the time they say they just, they had an itching at night and they just started scraping with their nails, or they were just, they don't even know in the sleep they have itched so much and that has started losing kind. So the major symptoms of it is like the skin starts becoming tender, hot, redness, and then what happens. So most of the time the bacterial infection needs an antibiotic. So they start with an antibiotic and course of 4 antibiotics that have a lower preference if it is not really disease. And according to Ayurveda, we have like 7 layers of skin. So according to in cellulitis, almost all the layers will be affected, all the the muscle. That's where the wound starts. So your skin gets cut and it starts oozing out. So doctor, is cellulitis has a more or anything kind of it can cause a morbidity in diabetes. See, cellulitis, I would say it's always a 1:2. Like a normal person developing a cellulitis, a diabetic person are developing the cellulitis. Forget the cellulitis, it's more of any kind of infections. The diabetic patients are always prone to infections. Second thing is uncontrolled sugar level, always diabetes, your nervous system. I have also spoke about the diabetic neuropathy that you would be able to understand. So the nervous system is also involved, and your peripheral nervous system is involved. So the peripheral blood supply is being involved because of your uncontrolled sugar levels. Then you have all the chances of developing of skin issues. That's what we see in cellulitis also. And when I speak about the prognosis of cellulitis or treatment of cellulitis, cellulitis is always, it's a joy. If you don't treat in that time, it spreads. It becomes so stubborn, and we have seen patients really suffering with that. So it's not so easy to get out of it. And when you are diabetic, then definitely it is not really so easy, because I won't be able to put you on so much of antibiotics or antibiotics post for a very long duration, because you also have an issue with what? Insulin metabolism. Insulin is a hormone, and you already have an infection in your body, so which might be obstructing your lymph node channels. That is where the infections are going more. So your ability to fight back of your body, the immune system, is already slowed down. And when you're diabetic, the fight backing capacity is more slower than a non-diabetic patient. So they will have, like for example, if the cellulitis prognosis in a non-diabetic patient is happening in a month to reach from stage 1 to stage 3. In a diabetic patient, it could happen within 50 days. So what we had was a dynamic. So the duration to treat them is also quite multiple. Sometimes they happen to try, multidisciplinary treatments, like they start doing for the wound cleaning every day, they start internal Ayurveda medication or other medications, they try some homeopathy, some other applications. But yes, all whatever the system of medicines are there, they're all trying to make sure that to control the bacterial infection. So how did this bacteria comes into your body? So it is also said sometimes it comes from outside with the skin and such. So sometimes through the indigestion of a food or whatever. But when you have a problem with your insulin metabolism, there is definitely a problem with whatever the infections you have in you. So you have to make sure if it is an untreated cellulitis in a diabetic patient, it can be as dangerous, or it is a morbid condition. So patients with cellulitis, you have to pay attention and you have to get it treated as early as you get diagnosed. Otherwise, you might have to result in a particular organ damage, system damage. So cellulitis has led to them some, yes, it becomes a diabetic, knocking, also gangrene, so septicemia. So it can over any extent. So cellulitis with diabetes is as dangerous as any type of tumor in your body. Like it just starts eating as fast, like you don't even get to know how fast it is eating up your body. So this is about cellulitis and diabetes. Thank you.